Hi everyone. The topic I chose for my paper was Ebola in West Africa. And I was drawn to this topic because, one, I am convinced that I might be a little bit crazy, and also because this was such a global crisis. I know it's something that was so complex and is still prevalent and happening now, and for some reason that appealed to me. Just to give you a little bit of an overview, this crisis has been incredibly complex. It has threatened lives and safety, as well as challenged the communication response during the course of the outbreak on both national and international levels. The communication and response to the outbreak has been widely considered inadequate, so I wanted to take a look at why this was and what some possible alternatives are, focusing on the need for an early communication response and an earlier partnering with organizations from around the globe. The organization most in the limelight during this crisis has been the World Health Organization, hereafter referred to as WHO. They are the only worldwide health organization and an arm of the United Nations. They are primarily funded by member states, and because of that, they're bound by certain constrictions and budgetary concerns, which will come into play later as we talk. To give you an overview of some statistics, this epidemic has been the largest in history. It's affected multiple countries in West Africa, as well as a small number of cases in Nigeria, Mali, Senegal, and imported in the United States. The total number of cases, as reported by WHO as of March 29, 2015, has reached 25,213. Laboratory confirmed cases is 14,797. The total number of deaths is 10,460. I personally think that the numbers speak for themselves, and to me they're just completely astounding. To go over a general timeline of how the crisis and responses unfolded, I think is very important. Looking back in 2014, the first case that was identified was in March. It was in June that WHO published their first press release. In July, WHO, along with presidents of affected countries, launched a joint 100 million response plan in order to try and control the outbreak. The key elements of this plan involve stopping the transmission of the virus and also preventing the virus from spreading and transmitting to neighboring countries. In August, the Ebola outbreak was finally declared an international public health emergency. In September, 6 months after the first case, the UN launched a massive international response, which was the first mission for a public health emergency in history. And this response was the United Nations Mission for Ebola Emergency Response. In October of 2014, the Ebola Communications Network was created. The ECN's primary focus is to identify best practices and inform evidence-based social and behavior change communication so that programs can have greater impact on controlling the Ebola pandemic. As the primary organization involved, I focused on WHO's crisis response to this Ebola epidemic. To start, they have been very forthright about the complexity of the crisis. Dr. Chan, who is the Director General of WHO, has stated that the complexity and the scale of things outstrip the capacity of WHO. Despite this, they did create a 5-point response strategy. The first point is to stop the outbreak. The second, to treat those infected. Third, ensure that essential services are in place. Fourth, preserve stability. And fifth, prevent further outbreaks. WHO used a variety of communication outlets to get their message out there to their various audiences. And these methods include regularly publishing press releases, including a plethora of information on their website, utilizing multiple social media sites, especially Twitter and Facebook, publishing a number of papers. Most recently in January of 2015, they published a series of 14 papers to look more deeply into the West Africa epidemic, especially looking back over the last year and what was learned. And they also launched a door-to-door campaign to make local people aware of what was going on. And their communication efforts really covered a wide range of information, from general information on, symptoms and treatment, fact sheets, pictures, human interest and survival stories, videos, etc. In evaluating WHO's response, I focused on 3 main areas that prevented the crisis from being handled effectively. The first of these is because of internal dilemmas, especially because of budget cuts and lack of communication or full cooperation by regional WHO offices. They also had their outbreak and emergency response units slashed, which made them even less able to handle a crisis of this magnitude. The second failure on their part was that they were so slow to respond. It took 4 months to be declared a global emergency and for communications on the crisis to begin. It took 6 and 7 months for an international response and the Ebola communication network to be created. The third, and I think probably biggest mistake that WHO made was in underestimating the complexity of the virus. I can't even begin to cover the scope of these complexities, but I do want to acknowledge that there are many contributing factors. Some of those factors include burial customs, economic inefficiencies of the affected countries, travel issues, public panic and other psychological effects like fear, confinement periods, gaining the trust of local people, the need to communicate with healthcare workers in order to train and educate them on the virus and its treatment, and also gathering the necessary amount of volunteers. And lastly, the fact that there were no 1 or even 2 organizations involved in this crisis. Dr. Chan argued it was a fantasy to think of the WHO as a first responder ready to lead the fight against deadly outbreaks around the world. So we really see that there was a necessity for other health organizations and government agencies to get involved in order to overcome the crisis. In looking at some possible alternatives or potentially better ways to handle the crisis, and I say this because hindsight is 20/20, and I certainly don't think of myself as an expert, but there are 2 areas that I saw as possible alternatives. And the first is earlier communication. So as soon as the first cases of Ebola were made known, risk communication with public should have begun by way of education and training of symptoms, treatments, and etc. And then WHO, especially with the use of their regional offices, could have reached the public early on via TV, radio, newsprint, community gatherings, notification to medical facilities, and things of the like. The second possible alternative is to engage in an earlier partnering with health organizations. In an interview with Time magazine, Dr. Chan stated, "If people think WHO alone can prevent this crisis, I think people are trivializing the reality on the ground." In my opinion, if WHO was aware of their lack of resources to handle such a massive crisis, they should have been partnering with organizations long before this crisis occurred. I do know that there are no easy solutions to a crisis that reaches the proportions that the Ebola outbreak has. But if WHO effectively partners with healthcare organizations, local communities, and government agencies, it can leave a legacy in healthcare systems. And I want to read a little quote I found from my paper that I couldn't even begin to summarize. "If we play this right, one of the legacies of Ebola could be stronger health systems that would emerge strengthened by community participation, resilience, and entrepreneurship. This could be achieved by showing people that they can indeed work across sectors, that communities have relevant expertise and much-needed cultural competence to develop communication strategies, media, and activities, and engage their own people, and that the role of teachers, religious leaders, mothers, business owners, community healthcare workers, and citizens can indeed be expanded to include much-needed skills and confidence to effectively address key issues in epidemics and emerging disease outbreaks. In the midst of a horrible virus that has created much havoc, much can also be learned. In this crisis, there was an adoption of social and behavior change communication, which enables organizations around the world to identify potential issues, such as with local customs, and communicate with sensitivity, persuasiveness, and effectiveness. But there's also more study needed using this model. This crisis also, as with any crisis, provides WHO with an opportunity to learn and make changes within its organization. As we were asked, I am going to read just a brief blurb from what I wrote in my press release. The Ebola crisis has posed many challenges and has revealed a number of areas in need of improvement. One of the challenges faced by the World Health Organization is identifying those infected with the virus in a timely manner. As a result of this challenge, a new area of research in real-time diagnostics will be underway starting this month. Advances in this area would enable early identification and early treatment. This will also assist in recognizing when isolation is needed and will potentially help halt the transmission of the virus. WHO is currently accepting donations to fund this research, which will ultimately help with any future outbreaks, not just Ebola. So I just want to thank you for your time and look forward to any feedback or questions you might have. Enjoy your day.